Hi, my name is Margaret Prust, and I'm a director on the Analytics and Implementation Research Team at the Clinton Health Access Initiative. It's a pleasure to be with you today. Health research is the basis for our understanding of evidence about health conditions, outcomes, and what works to improve the lives and well-being of individuals. But when women are not included in research or their perspectives are not adequately represented, policy and programming may fail to meet the needs of women. Even the most well-intentioned researchers can inadvertently introduce barriers to inclusion and representation of women. For example, in some contexts, lower literacy among women, limited experience with technology, or childcare requirements may make it difficult for women to participate in research. Even when women are included in studies, they may not be able to adequately provide input to the study if there are gender mixed focus groups or if all of the data collectors are male. And if we are not capturing gender appropriately and analyzing data with stratification by gender, we may fail to identify important differences in the experiences and outcomes across gender. And these are just a few examples that may arise. It's also critical to consider transgender, non-binary, and other underrepresented gender groups. Appropriate gender methods, data collection, and analysis practices are critical to understanding the perspectives and needs of these populations. CHI's work cuts across over 30 countries and many program areas. Each year, we launch about 30 to 40 human research studies using a wide range of methods, including clinical trials, cross-sectional studies, qualitative studies, and more. In my role at CHI, I provide guidance and leadership around generating evidence through research and other analytical means. But I wanted to find a way to highlight and influence how gender is considered not only in the studies that I personally work on, but in all of the research that my organization does. My goal is to ensure that we're conducting gender-responsive research. A version of the gender integration continuum is shown here as adapted for research. Research is gender responsive when it identifies and acknowledges gender differences and inequalities and takes deliberate action in the research process to address their impact on inclusion and representation. Over recent months, I created a guidance document that highlights the importance and relevance of gender responsiveness in research. I created this document in part based on my own reflections, experiences, and reading, and I also use the opportunity to expand and leverage my network by consulting with other individuals with relevant experiences and sparking conversations on this topic within research and gender communities at CHI. The resulting document offers 8 best practices that researchers should consider. This is not a one-size-fits-all approach, but rather is meant to inspire research teams to consider gender issues and ask themselves what is relevant to their own work. These best practices cut across all aspects of the research process, including recruitment, data collection, data analysis, and research team representation, and they are backed up by examples and data. I'm currently finalizing conversations with key stakeholders to get further input and generate buy-in. The guidance will be actively disseminated to CHI staff through our Research Review Committee and Gender Equity Network. I will work with the members of our Research Review Committee to incorporate these perspectives into their reviews and continue to raise active conversations on this topic and iterate on the guidance. While this work to date has focused primarily on gender, it's critical to look at other characteristics that may be associated with limited inclusion and representation in research, such as age, ethnicity, or disability status. I hope that this examination of gender will open a wider conversation about inclusion and representation in health research. This guidance could be relevant within other organizations as well, and I will leverage my network to find others that are interested in adapting this guidance and championing these conversations. The work that I've discussed here today represents only a small piece of what I've learned and gained through the WomenLift program. I want to sincerely thank my fellow cohort members and the WomenLift staff for being with me in an ongoing journey to expand my impact in the global health space and to act with care and intention. And thank you all for your attention today.